Let us continue. Yes, doctor.
Yes, medical school was divided into two cycles.
Okay.
The first cycle starting from Form 1 to Form 3.
No, year 1.
Yeah.
Form 1 is
okay.
specific for CZM.
Okay, good. From year 1 to year 3.
Oh, you can sit here.
And the second cycle from year 4 to year 6.
Okay, 6.5.
Yes, 6.5. Actually, there was not a seventh
year.
Yeah. So the first cycle is based on fundamental sciences.
Okay.
Fundamental sciences. Let's even say that even if those sciences are related to medicine,
they are not.
They are very close.
Okay.
To
just close the door.
They are very close to help. To help management, but you do not study diseases.
Okay.
How to
diagnose
them and to treat them. In the first and second year, maybe you can have some exercises.
Okay.
Describing patient's management, but they do not evaluate you based on your ability to manage
a patient.
You can study cases in the hospital, in school.
Yes, but
and there are real cases, but it is not based on how you examine
a patient,
how you provide treatment. So that is the first cycle.
Okay.
It is where you learn how is the normal anatomy, how is the normal physiology. You see?
Okay.
In the how you learn about pharmacology, you see, you learn drugs and so on. You learn microbiology, but you don't insist on diseases.
Okay. Yeah.
If you learn microbiology, you can learn, for example, about the germ.
The different germs.
The germ causing tuberculosis. But you don't learn tuberculosis as a disease.
As a disease. Okay.
It is from the second year that you now learn about diseases, going to the detail, how they are those, and how you manage, and so on. The first cycle is fundamental sciences.
Okay.
The second
cycle
is the fundamental sciences
applied fundamental sciences.
No, fundamental sciences applied to human health. You see,
which therefore means that maybe veterinarians and doctors, medical doctors, can do the same fundamental sciences.
Yes, at a certain level.
And when now it comes to humans, applying it comes to animals, they can separate. Okay.
You see, in some disciplines like pharmacology, you see, they use the same antibiotic to treat animals
and human.
And human. But for anatomy, it's maybe a bit different. From physiology, maybe the same thing.
Wow.
You see, to breathe, to urinate, the process is still the same.
Okay. No, it's now clear. So, second phase is fundamental sciences applied to humans.
Yes,
okay.
Yes. And at the end, the goal was to provide the society with general practitioners able to manage the most common disease in the public. So, a general practitioner trained in use at our time was able to do a cesarean section, to cure an hernia, to manage an ectopic pregnancy, and to cure an appendicitis. Those were the 4 surgical competencies
that a general practitioner from QUS.
That is why they will be sent to Molongo when there is no surgeon, but there is a small theater. They could be sent to, I don't know,
to Furawa, to my village.
Yes.
But Doctor, this one brings us to this problem. Is it that a country, in the design of the training of its medical staff, especially general practitioners, do they take into consideration, do they adapt that training to different countries based on their needs? Or it is...
The program has to be validated by the WHO. The program has to be validated.
The training program?
Yes.
Which therefore means that these schools that these private institutions, like Université de Montagne.
Yes.
I saw one in Mesasi.
Yes.
These schools. And now, at first it was only QUS, but now you have Medical School of Douala. Yes. So the curriculum must not only be validated by the government of that country, but also by WHO.
Normally, but as WHO does not intervene directly, WHO passes through
government
bodies.
Okay.
The Ministry of Higher Education.
Yes, Ministry of Health. So at that time, you had additional competencies.
Core surgical competencies.
But those were additional because...
Not additional. Those are the basic. They were the basic.
A general practitioner is not a surgeon.
He's not a surgeon, but he has to solve the common problems.
Health problems.
Yes,
on the field.
In the community. He has to be able to carry out a normal delivery.
Okay.
But he has to be able to carry out a complicated
delivery too.
That is
a cesarean C-section.
They are not asking to be able to do a hysterectomy, that is to remove a uterus. They are not asking to be able to cure a problem on the brain. No, they are. So normally, if a general practitioner at our time was not able to offer
these services, yes,
that means his performance
was questionable.
Yeah, questionable.
Questionable. Okay. So, doctor, you finished in medical school?
Yes, in 1990.
Wow.
I finished in 1990.
Okay. And before we go into your brief professional, please, is it possible for you now, when you compare the training then and the training now for general practitioners, what is lacking? Because I have Professor Eme Boni, who was a teacher in the medical school of Douala.
Yes.
I watched an interview of this man on one of these private television, and he was like, yes.
I think now there is a lack of, there is insufficiency of practice for
new recruits. Yeah.
Doctors.
I'm
not sure that before going out,
before graduating, yes,
many of them had opportunity to do a cesarean section. I'm not sure.
But it is part of the training.
It's part of the training. But now, if you go to a hospital, maybe you will see 10 doctors working there. Many of them have not been able to maybe do a cesarean section in the previous month. Do you think that they will be glad to let the incoming cesarean section be done
by an intern?
By intern. No, that's not possible. No, I think there is lack of
practice.
I also think that there is a lack of ethics.
Okay.
A lack of ethics. Of course, everyone needs money. Everyone wants to gain a lot of money. But I think that when you were trained, you were requested to put in front,
ahead
the service.
The service.
Yeah, the service.
And not.
And we were very proud to become doctor. And yes. And it was clear for us that being a doctor would not allow you to have certain type of behavior. I think things are different now.
So there was a code of conduct.
Absolutely.
For doctors.
Absolutely.
The code is still there now, but with the evolution, it doesn't mean anything to some.
And you see, one of my friends, Professor Jamshid Alfred.
Okay, yes, from Campbell.
The neurologist. You see, I was discussing with him. He said people coming into medical school, they are so young that they are afraid when they see blood.
Yes, many.
He's a teacher. At that time, he was vice dean in charge of scholarship. So, scholarity.
Of training, of academic affairs.
Yes. So, he was wondering if it may not be good to increase the age.
The minimum age to get.
To apply. Yes. So you see, they are sometimes, we can say that they are sometimes too young.
Yes, but I think that it is good for them to begin is the training still organized now in 2 phases? So to begin the first phase,
Yes.
apart from having the academic the training,
Yes.
they should also have some basic military training to build their minds.
I guess that you two were requested to go to ground day or military.
From some
it was 1 month of military exercise.
yes,
Pre-military.
pre-military some training. Yes. Okay, so doctor, you graduated and you had this ethics. Briefly, we all know that when you graduated, you went to the field. Can you briefly just, it will take just about 5 minutes for you to tell us how it happened that you found yourself at the position you are now after graduation?
Yes, after graduation, I had the opportunity to be part of the first batch of family planning national training program. So, USAID was supporting Cameroon to put in place a national family planning program.
Okay.
As I was a young doctor posted in Buddha, it was difficult to the CMO, the chief medical officer, to leave the hospital for 5 weeks to attend the training. And at that time, it was not the perspective related to family planning was not clear. No one imagined that it was a process. So while sending me to attend that training, they imagined that it was a one-time training.
For 5 weeks.
Yes, for 5 weeks.
Yes.
So I'm talking about this training because it is there that I met one of the trainer,
Yes.
a gynecologist, Senegalese gynecologist, Manuel Pina,
Okay.
who gave me information and recommended me to the boss, the professor in charge of gynecology and obstetrics training in Senegal.
So the trainer who recommended you, was he a Cameroonian?
No, a Senegalese.
Okay.
But who was trained in Senegal,
Okay.
who had a job in USAID. It was not a USAID supported NGO.
Okay.
Yes, in charge of so that USAID contractualized
Yeah.
with that international NGO, specialized in reproductive health training. And then the name was International Training for Health.
Okay.
So we contractualized with Intra,
Okay.
and we are using Intra to set up the family planning programs in different countries, including Cameroon. So as Manuel Pina was an Intra
Staff.
we
Okay.
get in contact.
We got
in contact when he was here, and thanks to him. So
you became now more interested in gynecology, obstetrics, and family planning.
Yes.
Okay. Go ahead. I'll stop the video.